Hey, it's Jessica DaMassa with WTF Health, and oh man, look who I have here. It's the chairman of Livongo, Glen Tullman. Hey, Glen. You think you're going to go public or what?
I can finally answer it now. I can finally say we did go public, actually.
Yeah, okay. Yeah, the ticker symbol's running along the bottom of the screen.
LVGO, NASDAQ listed. There we go. There we go.
Finally. Oh my God. You guys should check out the clip I'm going to put together of all the times I've asked this for the last year and a half.
There were a lot. So, you pushed us to go public. That's really
Thank you. So all of the shareholders, you're welcome. Thank you. Thank you. All right. So how did it go? I haven't had a chance to catch up with you since it went.
Look,
so how did it go down?
I've always said to people that the best day of going public is the day you go public. And then after that, you have a new set of responsibilities, a new set of challenges. The stock is going to go up. The stock's going to go down. The stock's going to go up again. You can't watch the stock every day. You have to get back. And the day after we went public, maybe 2 days after, we said to people, being public doesn't help our members. It doesn't help us grow the company other than having the capital and things like that. And we have to refocus on the business. We enjoyed it. We celebrated it. And now we're refocused on continuing to grow the business, focusing on our members, focusing on great clinical results, and focusing on savings and delivering more efficient health care for all of our clients.
All right, let's ask you other questions that you can evade now. So you got all this cash now. What are you going to acquire next?
Well, I think that one of the things we're doing, and we have said, we have a platform, a whole person platform. So we started with diabetes. You remember that?
I do.
And then we said, well, 70% of the people with diabetes have hypertension, so we added hypertension.
Yep.
Then we added diabetes prevention, weight management, and most recently, through a great addition, was mental and behavioral health.
Yep.
And so now we have that. And there are a few other areas that we're looking at, we're interested in. But first and foremost, we want to continue to deliver a great member experience. Because if you don't do that, you can lose your way. And then second, we will continue to look around and say, what else is out there that people, our members, want, and that all of their employers and all of the different folks that we work with, what platform do they want? And
any hint on that?
And so, well, I think we've looked at a few different areas, and we've said it publicly. We've looked at musculoskeletal. We've looked at respiratory. Yeah. Those are all correlated with things that we think we can focus on. Okay. So, that said, it's not, we're happy to have the money, and we're happy when we got out. Our timing was pretty good, I think.
Your timing was great.
And so that was good. And we're happy to be first, because this is establishing a new category called applied health signals.
I want to talk about that, and I want to talk about the fact that you guys went first. So tell me, from your perspective on the applied health signals category, what this means.
Well, we've always talked about the fact that there's really 4 C's in the economy. There's content, and that's what Google does. There's community, that's what Facebook does. There's commerce, and that's what Amazon does. And then there's care. And we see ourselves as the company that is going to actually digitize care. And so that's really the big 4 in the economy. That's why this is such a big opportunity. That's why investors were so interested in creating this category. Applied health signals really says that you take all this information, you aggregate the information, then you interpret it and you say, what does it all mean? And then you apply it back. You present it to people like you and me, and then we iterate. We say, did we use it or not? Just like Amazon figures out what books we want to read, and Netflix figures out what movies we want to watch, we figure out what care works and what insights and what health nudges are going to help people stay healthier. And when we do that, we can actually move the needle on care. And that's what people are seeing. When you move the needle on care and you keep people healthier, you reduce the cost. They're happier, and that's how this flywheel happens. And that's why all of these other companies grew so fast and so big, and that's what's going to happen with Livongo.
You're sticking yourself in there with some big tech companies. Are you a tech company or a healthcare company?
Well, I think that's the issue. We're a new kind of company. We're a consumer-first company that's focused on healthcare. And the one thing I'd say we're not, the tech is something we use. But anytime you're talking about technology, you're actually losing. Because people don't want to know about technology. No. They want you to create this magical experience. That's what they want. They want things to just happen. So we'll call someone's blood sugar is low in the middle of the night. And we will call them and say, are you okay? And they'll say, that was magic. How did you know? The reality, we knew because we have this connected technology, but they didn't want to know that. They just know that we were there when we needed them. And that trust that we build is what makes us a unique company and a special company.
You are really tech-enabled, though. What is the AI to AI, and that whole platform, the applied health? I mean, yeah.
And our investment in data science is what separates us from all the other wannabes. There's a lot of companies that say, we want to be like Livongo, but we don't have a SaaS-based recurring revenue model, and we don't have net promoter score in the high 60s, and we don't have.
I wish everyone could see the twinkle in this man's eye right now. He's trying the net promoter score.
Well, I'm pretty proud of our people.
Absolutely.
And what we've been able to deliver and the model that we built. But I'm also proud to have set that out there, because now I think we're going to see a lot of other people who say this is doable. The market recognizes you can build a great company that combines this consumer-first mentality that's in Silicon Valley with this deep knowledge of healthcare. And no one's really done that before. And so we're excited to have led the way, but we don't want to be the only ones in the category. We want there to be lots of applied health signals companies that come out and they do it. When we heard about Watson Health, and that was going to be it, and they had lots of data that they aggregated. They bought up everything. And then they actually really were good at interpreting it, but they couldn't close the loop. And that closing the loop of saying, when we served it up to someone, did they use it? And did it actually improve their care?
Didn't do anything, right.
Yeah. And that's what we've been able to do. And
the other way you guys are setting the bar, and I want to go back to the IPO for a second, is like, not only are you establishing.
You always love talking about the IPO.
Now that I have my moment, now that you've admitted it, that it's happened, I feel like I have to bask in this. So, no, but I want to go back to it because I think a lot of us in the industry have been looking at what the IPO meant. So, I mean, you're talking about, you guys are an applied health signals category, but we're also looking at you as the first digital health IPO.
That's right.
It is right. And so this is one of those things the industry has waited for a long time. The last set of IPOs was like Fitbit, and that was a while ago, and things were very different. So what does this mean? I mean, we're all, you can read whoever you want, Matthew Holt, whoever, talking about what the IPO for Livongo meant for the industry, but from your perspective, what does it mean for the rest of the health tech, digital health world that's trying to figure this out?
I just want to be on record. If Matthew Holt says it,
oh my God,
and it's good, and it's about Livongo,
and it's good,
it's true.
Okay,
it's true. I think that someone has to lead, someone has to be first.
Yeah.
We were fortunate enough to be there at the right time, and our timing was good, and we got out. And now I think there's a lot of companies who are saying this is a good model. It's a predictable model. It's recurring revenue. It's built outside the traditional four walls of the healthcare system, so it allows us to scale. When we add 20 or 30 or 50,000 new members in a quarter, those are numbers that you traditionally would only see in tech, and you wouldn't see companies that could scale. It was an office by office kind of model. And I think we've broken the mold there, and we've laid new ground to say, no, you can have companies that scale, that deliver measurable, sustainable value. And that's really what we're about. And I think that's why when people say, well, what about the market? It seems choppy. First of all, the market is definitely volatile and choppy. That has nothing to do with us.
No, there's like a trade war, right?
Yeah, there's a few things going on. But separately, what we're in this for the long term, and we're building sustainable growth. Our numbers are very predictable, and that's what the market will come to appreciate. And right now, they're still trying to sort it out. We have tech investors, we have healthcare investors, we have other investors who are just interested, who want to play, and they're all trying to figure out what does all this mean, and frankly, how we report that. When we have one member and she has multiple chronic conditions, we can't report on every chronic condition and every metric, so we're even sorting that out because it's a brand new category. But it's an exciting category.
The whole thing is exciting. Yeah. So when are you going to retire? I'm going to start that rumor now.
I don't know what I would do with myself.
I don't know what you would do either. You'd be so bored.
Every day, what is so great is every day our people come in, and our certified diabetes educators who talk to our members, like people say to them, you changed my life.
That's awesome.
And they come in, and we get people say, how do you recruit in Silicon Valley when you've got Facebook and Google, and all of these companies down, and we say they actually come to us. They come to us because they say, I don't want to do another search engine or another spreadsheet. I want to actually change the world. I want to make a difference for people. And that's what every day we're doing that with our technology and with our experiences that we're creating using that technology.
Keep it up, buddy. I'm excited.
Thank
Congratulations,
you very much.
finally. I can say that to you. Congratulations. Glenn, always a pleasure to talk with you. I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.